Let's listen to an expert doctor for hypertension in young population along with coronary artery disease and higher heart rate. Can be sure of happy heart? Today we have with us Dr. Avik Basu, MBBS MD, physician, currently working Care Now, Kolkata. How do we define hypertension and when should we conclude that the person has hypertension?
So hypertension is basically means that an adult person above 18 years of age and older, if the individual has got a systolic blood pressure of either equal to or greater than 140 millimeters of mercury and or a diastolic blood pressure of either equal to or greater than 90 millimeters of mercury, then obviously it is called hypertension. And any individual who is already on antihypertensive medication, irrespective of what the clinical blood pressure is, he or she is definitely a hypertensive patient.
Has there been a recent increase in the incidence of hypertension and heart attack among young patients? If yes, what could be the underlying cause?
Oh yes, there has been a recent increase in the incidence of hypertension among the young patients, cardiovascular incidence among the young patients. And the major issues are two, basically because of an increased level of stress, more so in the post-COVID era, and secondly because of an improper lifestyle. You will see numerous cafes, restaurants, fast food centers growing up and people are thronging these places. More and more consumption of junk calories, less and less burning of the calories, leading to the mal-effects of this processed food. All these culminating into early onset hypertension and the complications, mostly cardiovascular incidence.
What precautions should a patient take along with medications?
Besides medications, the primary aim of any individual who is suffering from hypertension or at risk of developing hypertension should be modification, strict modification of his or her lifestyle. That is, cutting down on the consumption of processed food or junk calories, engaging into activities, that is daily walk or exercise. You don't need to go to the gym, you just need to burn your calories. And you can engage into relaxation training, yoga to cut down the level of stress. And more so, you should cut down the amount of salt consumption. Among Indians, it is very high. We should try to keep it to minimal and avoid at all any extra salt or any salty food intake. All these, besides pharmacotherapy, can help in relieving the stress of hypertension.
Thank you, doctor, for your time.